Ready to discover a simple, natural solution that can transform your health? Imagine a powerhouse of benefits packed into one household item you probably already have in your kitchen. Yes, we're talking about baking soda. This humble kitchen staple isn't just for baking. When mixed with water, baking soda becomes an incredible, natural remedy that offers a wide range of surprising health benefits. From soothing heartburn and supporting digestion to improving oral health and even helping to reduce body odor, this simple compound can make a significant difference in your everyday wellness routine. It's time to rethink everything you thought you knew about baking soda. With just a glass of water and a teaspoon of this wonder powder, you can experience relief from common health problems without relying on expensive medications or harsh chemicals. Imagine a solution so versatile, it can help with everything from boosting kidney health to neutralizing acidity in your body. Whether you're looking to maintain a healthy pH balance or get quick relief from an upset stomach, baking soda is here to save the day. So why not give it a try? With so many hidden health benefits waiting to be discovered, incorporating baking soda water into your routine might just be the best decision you make for your body. It's affordable. It's easy. And best of all, it's a natural alternative that can support your health in ways you never imagined. Get ready to unlock the full potential of baking soda and take your health to the next level. How to drink baking soda water. Mix 1/4 to 1/2 teaspoon of baking soda in a glass, about 8 ounces, of water. When? Drink on an empty stomach, once a day, and only for short periods unless guided by a healthcare provider. Caution. Not for people with high blood pressure, kidney disease, or those on a sodium-restricted diet. What are the 10 health benefits? Let us see them. 1. Heartburn relief. Heartburn is a common digestive issue that causes a burning sensation in the chest, often rising up into the throat. It is usually the result of acid reflux, which happens when stomach acid flows backward into the esophagus, the tube that connects the throat to the stomach. This backward flow can irritate the delicate lining of the esophagus, leading to discomfort and a sour taste in the mouth. Many people experience this condition after eating spicy foods, large meals, or lying down too soon after eating. Baking soda, also known as sodium bicarbonate, is a natural compound that acts as an antacid. When mixed with water and consumed, it reacts with the hydrochloric acid in the stomach. This reaction produces salt, water, and carbon dioxide gas. The carbon dioxide may cause burping, which can relieve pressure and discomfort in the stomach and chest. The main benefit comes from the neutralization of stomach acid, reducing its ability to harm the esophagus lining. This effect provides quick and temporary relief. It is especially useful for people who do not have access to over-the-counter antacids or want a more natural remedy. Drinking baking soda water can offer relief within minutes, especially if taken at the first sign of discomfort. However, it should be used cautiously and not more than once a day without medical advice. The sodium content is high, and frequent use can lead to problems like high blood pressure and water retention. For those with chronic heartburn or gastroesophageal reflux disease, also known as GERD, baking soda water may not be a long-term solution. It can provide immediate comfort but does not address underlying causes such as a weak lower esophageal sphincter or poor dietary habits. Still, in mild or occasional cases, it is a useful home remedy, one that has been used for generations. It is inexpensive, simple to prepare, and effective when used properly. Always use food-grade baking soda, and avoid using it alongside large meals or fatty foods, which can worsen reflux. Overall, baking soda water offers quick relief, making it a valuable tool for managing occasional heartburn. 2. Indigestion aid. Indigestion, also known as dyspepsia, is a condition that causes discomfort or pain in the upper abdomen. It often comes with symptoms like bloating, nausea, burping, and a feeling of fullness during or after a meal. Many people experience this after eating too quickly, consuming fatty foods, or drinking carbonated beverages. The stomach produces hydrochloric acid to help break down food, but excessive acid, gas, or improper digestion can lead to irritation and discomfort. Baking soda, or sodium bicarbonate, acts as a natural antacid and helps to neutralize excess stomach acid. When dissolved in water and consumed, it enters the stomach and reacts with the acid. This chemical reaction produces salt, water, and carbon dioxide gas. the release of gas may result in burping, which can help relieve bloating and gas pressure in the stomach. The neutralization effect soothes the stomach lining, reduces irritation, and helps restore comfort, making digestion easier. Many people use baking soda water as a quick remedy for occasional indigestion. It is often taken after a large meal or when bloating begins to interfere with comfort. The alkaline nature of baking soda makes it effective at calming the stomach environment. This can also help break down food more efficiently by reducing the overproduction of acid. In traditional medicine and home remedies, this method has been used for generations to soothe digestive upset. However, it should be noted that this remedy is best for short-term or occasional use. Regular or excessive intake of baking soda can lead to increased sodium levels in the blood, which may contribute to issues such as high blood pressure, fluid retention, or even kidney strain. People with chronic indigestion or underlying gastrointestinal conditions should consult a doctor before using it regularly. Baking soda can also interact with certain medications, including aspirin and diuretics. 3. Urinary tract infection, UTI. Symptom relief. Urinary tract infections are common infections that affect parts of the urinary system, including the bladder and urethra. They are usually caused by bacteria, and symptoms include burning during urination, frequent urges to urinate, and cloudy or strong-smelling urine. Many people, especially women, experience discomfort and irritation during a UTI. The burning sensation is often due to the acidic nature of the urine, which worsens the inflammation caused by the infection. Drinking baking soda water may help provide temporary relief from some of the discomfort associated with UTIs. The key benefit lies in its alkalizing effect. When baking soda is mixed with water and consumed, it raises the pH of urine slightly, making it less acidic. This reduction in acidity may reduce the burning feeling during urination and help soothe the irritated urinary tract lining. It does not kill bacteria but can make the urine environment less harsh. This method is not a replacement for medical treatment. Antibiotics are usually required to eliminate the infection completely. However, baking soda water may offer comfort while waiting for medical care or while antibiotics begin to work. The temporary increase in urinary pH can help reduce irritation, especially when combined with proper hydration and rest. People have used this remedy in traditional medicine to ease urinary discomfort for generations. It is important to be cautious with this approach. Drinking too much baking soda can lead to electrolyte imbalances or high sodium levels, which may strain the kidneys. For people with kidney disease, high blood pressure, or those on a sodium-restricted diet, this remedy may not be safe. Using it only once or twice during the course of a mild infection may be acceptable, but it should not be relied upon as a long-term solution. In summary, baking soda water may provide short-term relief from the burning and discomfort of a urinary tract infection by slightly alkalizing the urine. It does not cure the infection but can ease symptoms. Proper diagnosis and treatment by a healthcare provider remain essential for complete recovery and prevention of complications. 4. Exercise recovery, lactic acid buffering. During intense exercise, muscles produce lactic acid as a byproduct of energy production. This buildup of acid can cause fatigue, muscle burning, and reduced performance, especially in activities that involve sprinting, lifting, or other high-intensity efforts. Athletes often seek ways to delay fatigue and improve endurance. Buffering lactic acid is one such method. The body has natural systems for managing acid, but in extreme exertion, these may not be enough. Baking soda, or sodium bicarbonate, has an alkaline pH. When taken before exercise, it can increase the body's buffering capacity. This means it can help neutralize excess acid in the blood and muscles, reducing the negative effects of lactic acid buildup. Studies show that consuming baking soda water about 60 to 90 minutes before intense exercise can delay the onset of fatigue and improve performance in short bursts of effort. This is especially helpful for competitive athletes. The process works by allowing muscles to continue contracting without being overwhelmed by acid buildup. Baking soda helps maintain a stable pH in the blood, preventing the drop in pH that causes early fatigue. Athletes who use this method report being able to perform more repetitions, sprint for longer periods, and recover faster between sets. However, it must be used correctly to avoid side effects such as bloating, nausea, or diarrhea. The dose typically used is around 0.3 grams per kilogram of body weight, taken with plenty of water. It is important to test tolerance during training. Not during competition, because some people experience digestive upset. Baking soda loading should also not be used frequently, as the sodium content is high. Regular use can raise blood pressure or cause electrolyte imbalances, and it should be avoided by people with kidney or heart conditions. In conclusion, baking soda water can serve as a temporary ergogenic aid for athletes by helping buffer lactic acid during high-intensity workouts. When used carefully and under guidance, it can enhance performance and delay fatigue, offering a natural method for improving recovery and endurance in demanding physical activity. 5. Kidney function support in early-stage CKD. Chronic kidney disease, often referred to as CKD, is a condition where the kidneys gradually lose their ability to filter waste and balance fluids and minerals in the body. In its early stages, the kidneys can still function, but damage begins to build up over time. One of the challenges in early CKD is managing the acid levels in the body, as damaged kidneys may struggle to remove excess acid from the blood. This condition is known as metabolic acidosis. Baking soda, or sodium bicarbonate, is an alkaline compound that can help neutralize excess acid in the body. When consumed in small, controlled amounts mixed with water, it may assist in restoring a more balanced pH in the blood. By reducing acid buildup, baking soda may help ease the strain on the kidneys. Some studies have suggested that this buffering effect can slow the progression of kidney damage in people with mild to moderate CKD. Doctors in clinical trials have observed that patients who took baking soda supplements experienced a slower decline in kidney function compared to those who did not. The belief is that lowering acidity in the body may reduce inflammation and cell damage in the kidneys, improving their long-term health. This is not a cure, but rather a supportive strategy that must be used carefully and under professional guidance. Baking soda water should never be self-prescribed for kidney issues, since the kidneys also regulate sodium levels. Introducing extra sodium through baking soda can create other complications, including high blood pressure and fluid retention. Patients with heart issues or advanced kidney disease are especially at risk and should avoid it unless specifically instructed by a nephrologist. Dosage and monitoring are critical, as misuse can worsen rather than help the condition. In conclusion, when used cautiously and under medical supervision, baking soda water may support kidney function in early-stage chronic kidney disease by reducing acid levels in the blood. It must be treated as a clinical tool, not a general remedy, and should only be used when the benefits clearly outweigh the risks, guided by careful lab monitoring and expert advice. 6. Gout symptom relief. Gout is a painful form of arthritis caused by the buildup of uric acid in the blood. When uric acid levels become too high, sharp crystals can form in the joints, leading to intense pain, redness, and swelling. The condition often affects the big toe but can impact other joints such as the ankles, knees, or fingers. Triggers for gout flare-ups include certain foods, alcohol, dehydration, and underlying health issues. Managing uric acid levels is key to controlling the disease. Baking soda, or sodium bicarbonate, is an alkaline substance that may help reduce uric acid levels by increasing the pH of the blood and urine. When mixed with water and consumed, it can help neutralize the acid in the body, making it easier for the kidneys to excrete uric acid through urine. This process may reduce the concentration of uric acid in the blood, which in turn can lower the risk of crystal formation in the joints. Some people use baking soda water as a natural remedy to ease the symptoms of gout, especially during the early stages of a flare-up. By slightly alkalizing the body, baking soda may help dissolve uric acid crystals or prevent them from forming. It can also reduce inflammation in the joints, leading to less pain and stiffness. However, the effect is temporary, and it should not replace long-term treatment or lifestyle changes recommended by healthcare professionals. Too much baking soda can introduce a high amount of sodium into the body, which may raise blood pressure and stress the kidneys. This is particularly dangerous for individuals with heart disease, kidney conditions, or those on a sodium-restricted diet. Using baking soda water for gout relief should only be done occasionally and in small doses, ideally under the supervision of a healthcare provider to prevent potential complications. In summary, baking soda water may help reduce gout symptoms by alkalizing the body and promoting the removal of uric acid through urine. It offers temporary relief and may be used as a supplementary approach. But long-term gout management still requires dietary control, proper hydration, weight management, and possibly prescribed medication for sustained results and joint protection. 7. Improved pH balance. The human body is designed to maintain a very narrow pH range, especially in the blood, which stays between 7.35 and 7.45. This slightly alkaline range is vital for proper cell function, enzyme activity, and oxygen delivery. The body uses several systems to keep this balance, including the lungs, kidneys, and buffer compounds like bicarbonate. Despite the body's natural regulation, some people believe that lifestyle and diet can influence the body's acid-base balance, especially when consuming highly acidic foods. Baking soda, or sodium bicarbonate, is one of the body's natural buffering agents. When consumed with water, it introduces bicarbonate into the system, which can temporarily raise the pH of bodily fluids, especially urine. This mild alkalizing effect may help in neutralizing excess acid produced by certain foods, medications, or metabolic processes. Supporters of the alkaline diet claim that a more alkaline environment in the body can reduce inflammation, improve energy, and prevent disease, although these claims are often debated. Drinking baking soda water in small amounts may help reduce the acidity of the digestive system and urinary tract. It does not significantly affect blood pH in healthy individuals, since the body tightly controls that balance. However, it may affect local pH levels in tissues or excretions, such as saliva or urine. By helping the body excrete acids more efficiently, this can be useful for people with mild acid buildup or those undergoing temporary physical stress. It is important to note that the effect is short-lived, and the body will quickly restore its natural balance. Regular use of baking soda to influence pH can lead to high sodium intake, which may result in elevated blood pressure, water retention, or even kidney strain in sensitive individuals. People with chronic conditions or those taking medications should not attempt to alter their body's pH without professional guidance. In conclusion, while baking soda water can temporarily support the body's pH regulation efforts, especially in times of minor acid overload, it is not a long-term solution or substitute for healthy lifestyle choices. Its value lies in short-term, occasional use to ease acidity-related discomfort, under careful observation and within safe dosage limits. 8. Natural antacid for stomach ulcers. Stomach ulcers, also known as gastric ulcers, are open sores that form on the lining of the stomach. They are usually caused by an infection with a bacterium called Helicobacter pylori, or by the overuse of nonsteroidal anti-inflammatory drugs such as ibuprofen or aspirin. Ulcers cause a burning pain in the stomach, especially when it is empty. They can also lead to bloating, nausea, indigestion, and in severe cases, internal bleeding. The presence of acid in the stomach worsens the discomfort by irritating the ulcer site. Baking soda, or sodium bicarbonate, is a naturally alkaline compound that neutralizes stomach acid when ingested, when mixed with water and consumed. It reacts with hydrochloric acid in the stomach to form salt, water, and carbon dioxide. This reaction reduces acidity and relieves the burning pain caused by acid contact with the ulcer. In this way, baking soda acts as a temporary antacid, offering quick and simple relief without the use of synthetic medications. Its soothing effect makes it a popular home remedy for those suffering from ulcer-related discomfort. It may help calm the stomach before meals or before bedtime, providing short-term comfort during healing. Unlike some antacids, it does not coat the stomach lining, but it does reduce the acid level, making the environment less hostile for healing to occur. The release of gas may also help reduce bloating and the sensation of fullness that often accompanies ulcers. However, baking soda water does not treat the root cause of ulcers. It does not kill Helicobacter pylori or repair damage to the stomach lining. Long-term relief and healing require medical treatment, which may include antibiotics and medications that reduce acid production. Excessive or frequent use of baking soda can also lead to sodium overload, alkalosis, or strain on the kidneys, and may interact with prescribed ulcer treatments. In summary, baking soda water can provide quick, temporary relief for stomach ulcer discomfort by neutralizing stomach acid. It is effective for easing symptoms but not for curing the underlying condition. Responsible use as part of a broader treatment plan may help patients manage pain while undergoing proper medical care. 9. Oral health support. The mouth is home to a wide range of bacteria, some of which contribute to tooth decay, gum disease, and bad breath. Maintaining a clean and balanced oral environment is essential for preventing dental problems. Brushing, flossing, and using mouthwash are the standard tools for oral hygiene. However, baking soda, or sodium bicarbonate, offers additional support due to its natural properties that fight acid and bacteria, making it a popular ingredient in many toothpastes and oral care products. Baking soda is mildly abrasive, which means it can help remove surface stains from teeth without damaging the enamel when used gently. This makes it useful for whitening teeth naturally. It also neutralizes acids in the mouth that come from food and bacteria. These acids can weaken tooth enamel and create an environment that encourages decay. By raising the pH in the mouth, baking soda helps protect enamel and slow down the growth of harmful bacteria. When mixed with water and used as a rinse, baking soda can help freshen breath by reducing mouth acidity and neutralizing odor-causing compounds. Its alkaline nature can also soothe minor mouth sores and reduce irritation from acidic or spicy foods. Regular use of baking soda water as a rinse may help maintain a cleaner and less acidic oral environment, supporting gum health and preventing plaque buildup. However, it should be used in moderation. Brushing directly with baking soda too often can wear down enamel over time if done aggressively, and it lacks fluoride, which is essential for strengthening teeth and preventing cavities. Therefore, baking soda should be seen as a supplement to, not a replacement for, regular toothpaste that contains fluoride. It is best used a few times per week or as advised by a dentist. In conclusion, baking soda water can support oral health by neutralizing harmful acids, reducing bacteria, and freshening breath. Its mild abrasiveness helps with stain removal and whitening. When used responsibly, it offers a natural, effective addition to a daily dental hygiene routine, helping to protect teeth and gums without harsh chemicals. 10. Relief from acidic body odor. Body odor is primarily caused by the breakdown of sweat by bacteria on the skin. When sweat from apocrine glands, particularly in areas like the underarms and groin, mixes with bacteria, it produces an unpleasant smell. Certain factors such as poor hygiene, spicy foods, hormonal changes, and medical conditions can worsen this odor. One common but often overlooked contributor is body acidity. When the internal pH becomes more acidic, the sweat produced can also have a more pungent and irritating odor. Baking soda, or sodium bicarbonate, is well known for its ability to neutralize odors due to its alkaline nature. When consumed with water, it may help reduce internal acidity slightly and influence the composition of bodily fluids, including sweat. By raising the pH of the body mildly, baking soda water can make the sweat less acidic, which in turn may result in less interaction with odor-causing skin bacteria, leading to a reduction in unpleasant body smell. In addition to internal use, baking soda is often applied directly to the skin as a natural deodorant. It absorbs moisture and neutralizes acidic components on the skin's surface. However, drinking it offers a more systemic approach, particularly for people whose body odor is linked to high acid levels. Regular consumption of baking soda water in safe amounts can gently shift the body's pH and help manage odor from the inside out. Despite its benefits, care must be taken with its use. Consuming too much baking soda can result in high sodium levels, leading to bloating, increased blood pressure, and kidney strain. People with kidney disease or heart conditions should avoid internal use unless approved by a healthcare provider, and the use of baking soda should be occasional, not a daily habit, to avoid complications. In summary, baking soda water can offer relief from acidic body odor by reducing internal acidity and altering the nature of sweat. This can result in less odor production when sweat interacts with skin bacteria. It is a simple and natural remedy that may support better body freshness when used responsibly and in moderation. In conclusion, baking soda water is an incredibly simple yet powerful natural remedy that offers a wide range of health benefits, from soothing indigestion and heartburn to supporting kidney health and improving oral hygiene. Its versatility makes it an accessible and affordable option for those seeking a natural way to enhance their well-being. While it's important to use baking soda water in moderation and under the right circumstances, when used responsibly, it can serve as an effective tool in managing various health issues. Incorporating baking soda water into your routine can lead to improved digestion, better pH balance, and overall enhanced health. However, as with any health practice, it's always best to consult with a healthcare professional, especially if you have pre-existing health conditions. Embrace the power of this everyday household ingredient and enjoy the many ways it can support your journey to better health.